Hello and welcome to this Future Care Capital Getting Public Health Communication Right webinar. We're going to spend an hour reflecting on some of the lessons learned from the public health communication through the first wave of the pandemic and beyond, and explore ideas of how we do this better in the future. The session will start with a few comments from some of my panel colleagues here, followed by a panel discussion where you'll have the opportunity to ask some questions, and we'll do a Q&A session there as well. So do be prepared to raise questions online. I'm delighted today to have with me a panel of experts. I'm Greg Allen, I'm the Chief Executive of Future Care Capital. And Future Care Capital is a charity that's been around for 70 years or so, focusing on influencing and impacting health and care policy and raising the debate around that. And with me, I've got Ben Page from Ipsos Mori. Ben is the Chief Executive of Ipsos Mori. He's been there since about 1987, I think. And Ben's a frequent writer and speaker on trends, leadership and performance management. And he's also directed thousands of surveys examining consumer trends and citizen behaviour, as well as a number of other roles that he's got. I've also got Jenny Ousby with me. Jenny began her career as a political journalist and is a respected industry leader in healthcare, public affairs and advocacy. And she founded Ovid Health in 2018, as well as previously being a political advisor to a Liberal Democrat health minister. And finally, I've got Dan Papworth-Smith with me. Dan is the head of digital engagement at Breast Cancer Now, which is the UK's largest breast cancer charity. And he also spent 6 years at Teenage Cancer Trust. Before I move across to my panelists to say a few opening remarks, I'd like to just focus on three things from my own perspective. One is that I think in terms of public health messaging and public health messaging over a prolonged period, this is a really important thing for government, clearly, especially around adherence to behaviours and restrictions in a pandemic. But I'd emphasise that it really isn't easy. So that's perhaps a starting point. Secondly, something about the public health, the economy and the future, and the balance the government needs to strike between messages about these three things, particularly with Brexit, the economy, the noise from the US election, to name but a few things in that sort of equation. But also on a personal note, as a parent of children at university, I think it's been challenging to explain some of the messaging and support them as they live away from university. And we tackle some of these issues and how public health communication plays its part in that. But I'm going to move on now, first of all, by introducing Ben to say a few opening comments. Ben Page.
Thank you very much. Let me find some slides. So hopefully you can all see this. So this is just some reflections on the detailed work that we've been doing since February, so long before lockdown, looking at where the public were on the virus and what we've sort of observed over the last months in terms of public reactions. And the first thing I think to note is that the British have been pretty critical of their government. In fact, in this work at the end of October, the British were among the most critical globally, which is pretty dramatic. I mean, we have had a relatively high percentage of deaths relative to our population, but nevertheless, lots of other governments have done pretty badly as well, and yet the British are pretty negative. It's worth saying that the British are negative about their government, whoever it is, at almost any time, but they are particularly critical. And it's clear that the governments like New Zealand and Germany, who are regarded as having been more consistent, have got higher ratings from their populations. Overall, the communications part of this started well. So you can see that back in March, 9 out of 10 people thought the message "stay home, protect the NHS, save lives" was pretty clear. But as you can see after that, as we went into messages around things like "stay alert, control the virus," things got a lot more complicated, and moving to different tiers with different national arrangements in Scotland and Northern Ireland and Wales as opposed to England has also not helped. And so you've now got a majority of people saying that things aren't clear. And I think that's a real challenge because, and we'll certainly come to this in the discussion, sometimes, we need a more nuanced message. This is about balancing risk as opposed to completely closing the economy entirely. And, that's tricky because the public doesn't necessarily always like nuance. So what has worked, and this is some work that we did for Future Care Capital back in June, I think, is, there was absolute clarity for the public about what the symptoms are, when to self-isolate, how to reduce the risk of infection, more complexity around when should you socialize, where can you go to, how can you work safely. And it may be that there's, where there's those messages, where there's nuance, it's a bit more tricky, but certainly most people got quite a few of the messages fairly clear. And overall, of course, despite a lot of noise on social media, you can see that 3/4 of people now in October saying that they're following the guidance, the rules, either completely or nearly all the time. There's only 4 people in 100. I mean, maybe there's desirability bias in these answers, but I'm not sure, saying that they pay no attention at all. And so most people want to be compliant, and despite saying that the messaging isn't always as clear as they might like. And why is that? And I think this is important, is that they do buy into the rules. So why, which of these reasons do you find most compelling? To stop it spreading, 87%, to ensure the NHS isn't overwhelmed, to stop my friends getting it. You've got 9 out of 10 people buying into all of these things. And it's they're doing it for positive reasons rather than for sort of transactional ones. I might be fined or something like that. Although interestingly, we found a large proportion of people were quite happy to see quite draconian fines imposed. And indeed, people want to crack the virus. Interestingly, though, and I think in the events of what's been going on in Downing Street over the last week, when we look at why people might say, I won't follow the rules, and you've got 1/4 saying they don't sometimes, the biggest issue is this point about hypocrisy. People in government haven't been following the rules, so neither should the rest of us. 47% see that's the most compelling reason. So going for your driving test around Barnard Castle to find out how bad your eyesight is with the virus is a really bad thing to do if you're wanting to communicate clearly. And then having a press conference to defend said behaviour is also really, really unhelpful. And I think it's very noticeable, Boris Johnson now having been exposed to the virus for a second time, saying that he's going to self-isolate for 14 days and follow the rules. And that's if they had done that early on, they may have found some of the other stuff easier. And if Dominic Cummings had perhaps been persuaded to follow the rules, but he's gone now anyway. So, we can see that the public wants to follow the rules. The next challenge, of course, is just persuading people to take the vaccine. And what we're seeing, and have seen during the course of 2020, is although we've got in Britain at the moment 79% saying that they would take the vaccine if it was available, that's down from 85%. And it will be interesting to see as more discoveries come online. We've got another vaccine coming out with, I think, 95% success claimed today in trials, exactly where these numbers bottom out. But it does appear that right across the world, generally, if anything, people have become a bit more skeptical, perhaps because they're worried that these things are going to be rushed. So we've still got plenty of challenges to go in terms of public health communications, and not least getting a 2-dose vaccine into millions of people, while social media is still letting people tell lies about it night and day. The end. I'll stop sharing.
Thanks, Ben. Very succinct, thank you. And I'm taking from that certainly this sort of message, I suppose, around the public as a partner, not just as a recipient of messages, and that element of trust coming out there as well, and the need for trust. Thank you. Jenny.
Great, thank you, Greg. So, we're a specialist health communications agency. So, and I'm coming from the perspective of both being a political advisor and being in-house, and also, of course, working for clients. And certainly over the last year, we've been supporting clients with all kinds of pandemic-related communications, from helping our client MedCity set up the London Testing Alliance, which helped to put online hundreds of thousands more tests, diagnostic testing, as well as being in a strange position of helping to advise one client to get hold of additional PPE for their healthcare workers, and helping them to facilitate potential talks with local curtain manufacturers, which is certainly a conversation that I never thought I would ever have as a communications consultant. So, and I think one of the key lessons that I was reflecting on, which is really the pandemic has really brought into sharp focus, which is you can't necessarily tackle facts with facts. And I think emotional resonance is something that I'll probably bang on a lot about today. And you know, you've seen that in, you know, why the trip round Barnard Castle hit home. I think you've seen that in Marcus Rashford's incredibly effective campaigning in the past kind of month or so. Is emotional stories carry weight just as much as facts and data. I think particularly when people are being bombarded with a tsunami of it. And I think for us, you know, Ben mentioned just then about vaccines and vaccines confidence. That's clearly a big concern and focus for the government over the coming months and year. And I think for us at Ovid, this is about, you know, a huge public get out the vote style campaign in terms of vaccines. And I think we'll probably talk a little bit later in terms of age and demographic and how actually it's really important to be communicating with slightly younger people about vaccines and uptake. Thinking about my experience in government, I mean, one of the major issues that I helped to communicate, and you could argue definitely that the job still isn't done, was on social care and on social care reform. And I think there are some parallels to be drawn between an area of public policy that affects most people, and yet most people still don't quite understand it. And I think you could probably say the same for certain elements of the virus. But again, facts and emotional resonance playing a great part in that. I think I'd also reflect, and you know, you've got Dan talking shortly, but I think charities have done an incredible job actually under really difficult circumstances, kind of rapidly adapting their services and giving an offer to patient communities. But I think that, you know, we work with a lot of pharmaceutical clients, and I think that those partnerships between the public sector, the third sector, and the private sector, I think in terms of communications and getting out public health messages, whether it's on the virus or whether it's on cancer or diabetes, will become increasingly more common, I think, over the next year. I think trust, clearly there's been lots written about trust. You know, Ben mentioned the recent news about the second vaccine that potentially is coming online. And I think that, you know, the big question for us in communications is whether those levels of trust will remain the same as we potentially, from the media, descend into conversations around price and effectiveness and safety around vaccines, and whether that will help or hinder trust in that sector. And I think finally, you know, we've talked a lot about life going back to normal, and we have a government and a prime minister, an economy that very much wants that, as well as a public. But I think for me, the big communications question for people working in public health is going to be about communicating to the public what does life back to normal really mean, and having a grown-up adult conversation about that. And I think that's something that they need to start looking at now.
Thanks, Jenny. Some great opening thoughts there. Thank you very much. And I'll move on now to Dan.
Great, thank you. So I think from, as Jenny kind of said, from my perspective, coming from the charity sector, we've had a really, really hugely tough year in terms of the impact that COVID's had on not only kind of our service work, but also our fundraising work. And I think kind of combined with our face-to-face services, our patient support having to stop in a large kind of number of our kind of the angles that we do provide that. Things like mammograms, breast checking pause kind of mean now we have a huge backlog of people who haven't been able to have their breast scans that they would normally be having. Uncertainties around drug availability. At the start of the crisis, there was a big scare about actually, will there still be kind of priorities for these drugs? Because we knew we were still going through Brexit negotiations at the time, and a lot of people were actually very unsure about whether they would be prioritizing their medication through this. And also there's about things like hospital capacity. I mean, still now we're seeing people are largely not going in and speaking to their GPs, they're not going in to speak to their doctors. They're not feeling comfortable with either kind of putting additional strain on the NHS, but also kind of trying to feel like they can have that agency to use that currently, and that actually they should be prioritizing COVID patients, which obviously is not the case, and the NHS is open for everyone. And like the first lockdown for us was a hugely difficult learning curve. We adapted really well, I think, to it, but we did have to furlough 70% of our workforce, which is huge. And it's just kind of off the back of so many of the kind of fundraising events and opportunities that we would normally have in a year being either postponed or cancelled or taking very different forms, companies scaling back, all sorts of kind of different reasons behind that. And I think kind of going into this kind of second lockdown, but also into the next year, I think it's going to be really important that we don't rest on our laurels and that we still kind of appreciate how uncertain things are now that they are feeling a bit more normal to us. I know kind of a lot of us maybe are finding this second lockdown a little more straightforward, having been through it before. It doesn't mean that the people that we're supporting and the people we're providing information to are finding that the case. And actually, I think going into Christmas particularly is going to be a tough time. So yeah, kind of making sure that we're looking into the new year, looking to really continue that support, as kind of Jenny was saying about what is normal now, what is kind of this new environment that we're living in, and how does people's diagnoses fit within that.
Thanks, Dan. Again, some great points there. I'm just reflecting on Ben's reference to sort of vaccine confidence, and Jenny talking about how we get life back to normal, and Dan, you there talking about the massive backlog around services and not sitting or resting on our laurels. And of course, as we think about where we are currently in this lockdown, maybe this is even easier to explain the current lockdown and restrictions compared to the tier system that we had just before this lockdown, and therefore what it's going to be when we come out of this lockdown. Is it going to be more confusion again? But just on that point, Ben, if I can come to you first, if I sort of dive in again to the public trust issue and point. I mean, in terms of this idea of the public as a partner in the context of those points that have come out so far, what are your thoughts?
Well, it's, trust is hugely important. We are, ipsos mori, is against the prevailing narrative that trust in the West, in the Western democracies, is in terminal decline. And we wrote a report about it last year because we were so concerned about the lazy meme that trust is collapsing. Now, so overall, most people still trust Patrick Vallance, whatever he says with the Prime Minister. His trust in scientists is pretty high. Trust in the media, interestingly, hasn't changed at all during the course of the pandemic. We do detailed studies on this and across British media, and indeed separately the Ofcom tracking study. So trust is hugely important, but we mustn't sort of be suicidal and say there's nothing you can do, etc. I absolutely agree with Jenny around the need for emotional connection, and I think too often it's this, we are also, a lot of science people are terribly rational. So you just tell people the facts and then they'll sort of be rational about it. And that's where, and that applies in all sorts of areas. I mean, you can relate it to Brexit as well. So understanding that emotional connection is hugely important. But trust matters, yes. And part of trust, and we've looked at political trust in leaders during the pandemic. So we compared Britain, America, New Zealand, Germany, and Italy, and France. And what was interesting is, of course, the Germans and virtually everybody did better than Britain and America, to be quite honest. America did worse with Trump because half the time he says it doesn't exist, then it does. I mean, it's all over the shop. But Britain didn't do too well. But it's those leaders that have managed to be sort of personal, but also, I think this is the key point, consistent and fairly sort of transparent. And the difficulty in Britain is that sometimes, partly because of noises off, I suspect, the government appears to be, telling people you'll be fired if you don't go back to your office, and then the next week they're telling you don't go to the office. This is the problem. So those countries that have managed to maintain consistency have maintained higher levels of trust during this year, even though we all had a rally round the flag effect early on. And people want to support the government. They want to deal with this.
Thanks, Ben. And just on that consistency point, Jenny, if I can come to you. I mean, the reference to sort of hypocrisy previously, and I'm just thinking of Dominic Cummings now having exited Number 10. What are your thoughts about how things might suddenly change with him leaving in terms of that element of consistency and trust?
Well, I think it's interesting. I think there's been a lot of opinion pieces over the last 48 hours, some of which I think are quite hopeful about how there'll be this great shift in the way the government works and how comms emanates from the centre, and how it's managed. I think that perhaps some of those opinion pieces are potentially premature, not from a party political standpoint, because I think it takes time to have such a shift from that campaigning mode to the mode of governance. So I will have to stay on the fence on that a little bit, because I think we're yet to see who will be the chief of staff, how those kind of new interactions will work. I think I wanted to pick up on what Ben was saying about this repetitiveness of message and communications. And Greg, you mentioned just then about the kind of the tiered approach before we went into national lockdown. And, you know, I take my litmus test from the hairdressers and the conversations I overhear in it, I should add, just before the second lockdown. But, you know, the fact that I cannot remember the number of times that people have said to me, is tier one the bad one? Or is tier one the okay one? Because is one bad or is that okay? And so I think that there's a clarity of message that's required around, you know, is it medium, high and severe? And, you know, we were tested a lot of those things in the headlines through the traffic light system, the tier ones, etc. And I wouldn't be surprised that if we go back to a regional tiered approach, then they will have a different name, because I think there was general confusion around that.
Thanks, Jenny. And as someone like you who lives this day to day in terms of the commentary and the analysis, I found when my 20-year-old and 18-year-old have asked me about when they're going to be evacuated from university in that time window, what exactly that means, and I'm still trying to work out the timetable and who says what to whom to make that happen. But Dan, just going back to you in the context of those comments and thinking about what you say to your audience and to the people who are beneficiaries of your charity and those you speak to, what's at the front of your mind at the moment?
I mean, I think in terms of that kind of trust angle, I think that is so fundamental. I think for the last 2 years, there have been kind of several big pieces around trust in charities is falling. People are not kind of wanting to kind of be kind of supporting these causes necessarily in the same way. And it's just so fundamental for us. We're a charity that a large part of what we do is information provision. So whether that's kind of online information through our website or we do a lot of printed information in hospitals. So often the first time people will kind of be given a leaflet or a pamphlet after their breast cancer diagnosis, it will often be from us. And it's so important that when they receive that, or when they kind of receive information from us, that it is trusted. Because if there's kind of, like you said before, any kind of wavering in that messaging, if it's inconsistent, if it doesn't make them feel that we know what we're doing and that they can trust us, then it's already a disconcerting part of your life, kind of having that diagnosis. So we do a lot of work with groups like the Patient Information Forum to really kind of work and make sure that all our information is verified and is checked regularly and is updated and accessible and easy, plain English language. So there's kind of lots of work we're trying to do to really make sure that we can be seen as a trusted charity and that the people who are receiving the information from us don't have those kind of mixed messages or that kind of feeling of uncertainty when they're looking to us.
Thanks, Dan. And it reminds me of the work I do with hospice care in Devon, actually, as a trustee there, and the way that we have the conversation about death and these difficult things. And in the first lockdown, the conversation that was being had about death, I think, in terms of the numbers and the daily briefings. And in my view, in this second lockdown so far, we seem to have moved away from that. You know, we've gone past 50,000. It's just a number, isn't it? But yet we're not really having that conversation. The conversation seems to be more about the comings and goings in Downing Street and other things, in my view. So just in terms of building trust, any final points on that particular part of this conversation? I'll open that up to any of you there.
Well, I think when we talk to clients about trust generally, we actually tell them not to worry about it as much, because many of in a completely different sphere, many of the large banks in Britain are very obsessed about trust. They've had their own problems in the sector over the last decade, and they have all sorts of indices in some cases that they use to measure their performance. And I keep telling them not to, because actually, what the Daily Mail or whatever writes about banks as a whole is likely to impact on you, whatever you actually do yourself. And so instead, focus on excellence and focus on competence. And I think, and that is, and then you will build trust. If you do what you say you will, and it's very clear, then particularly if you're starting from perhaps a challenged position. And so I think that one of the issues for government, again, and we've seen so many examples of world-beating things that were going to be ready by certain times. It is about under promising and over delivery, and if they can do that seems to be the way back from this. If you say it, don't say it's going to happen until you can actually do it. The example I always use on this is McDonald's. So McDonald's, when they decided to offer free-range eggs in all of their burgers, it apparently took them 10 years to build a supply chain at the time of free-range eggs before they could actually guarantee that every McDonald's restaurant would have free-range eggs in it. They didn't tell anybody they were doing this until the last restaurant was ready, and then they put it all on all of their trucks. It took literally years. The trouble is, in government, of course, it will be, we'll have world-beating eggs ready next, and then of course it won't happen. And so there is a real, of course, they're under huge pressure, and they're getting those daily statistics about the number of people testing positive, the number of deaths. It's like a cold, you can imagine what it's like in the centre, and I think we've got to have a lot of sympathy for them. And the public don't like risk and uncertainty, which we're trying to communicate here. But there is something about focusing absolutely on competence, under promising, and then over delivering, and that might be partly the way out. I'll shut up.
I think it's about having a grown-up conversation, and I think it's also about being like relatability. Like Greg, you just talked about the horrendous daily mortality rate that's is covering, and I think you're right. It's not getting as much cut through, not because it's no more tragic, but because it's becoming an awful way of life for people and families. And I think that the way I'd reflect on that is about relatability. So every one of those deaths, I think some of the most powerful images or stories that I certainly noticed during lockdown and the pandemic have been those photos, for example, of families who are trying to see their relatives through a pane of glass. And I think that sometimes that image can really bring across a message that a figure or a stat can't, or a story. So speaking personally, I haven't seen my grandpa for nearly a year, and he's been in a care home, and I can't tell that story because I'd get upset and it would be emotional, but I bet you'd all remember it, and I think it would carry so much more weight. So I think it's about, and the government, that has to be part of their kind of armory of tactics when it comes to communicating.
Thanks, Jenny. Dan, I'm going to bring you in a second, but I'm actually going to move on from the sort of public trust piece and think about the specifics around the positive role of social media, because when I reflect on the research that we've done with Ben and his team, it's interesting seeing over the 4 reports how things progressed during the pandemic so far. And certainly it's been a force for good, social media, in terms of sharing positivity, building connections online where we're physically distant, using online platforms to share advice and tips even. And I think that also plays to, well, what about those who might be digitally excluded? But does that surprise you, that kind of positive aspect of social media? What are your thoughts on that, Dan?
For me, not at all. I've been working in the social space now for almost 9 years, and we've kind of seen across the charities that I've worked with that people really, that's the kind of the content people want to see on social media. People aren't interested in the negativity and the horrible stuff they see every day in the news. They want something kind of, something they can connect with, something they can feel on some emotional level, more than just, this is really sad. You just get bogged down by that. And something we've kind of always had as a really key pillar of how we approach social at the charity is all really around people's own stories and their own experiences of breast cancer. And we work with a lot of women and men with breast cancer to talk about their experiences directly and use our social channels as a platform for them. So we often find actually that we've now built a community of people who will read a post that we've kind of done, and we'll have a conversation with each other and share tips, share experiences, share how they've been finding things, share how share support for each other, see someone else is kind of maybe having not such a strong time at the moment and be there and kind of be comforting to them just in the comments within a social post. And I think that's kind of that beautifully kind of supportive environment is something that is really important for us to create at this time and really kind of foster that positive role that we can have in steering that and kind of making sure that we are there and providing not only a real perspective of breast cancer, but actually a positive one that is engaging and that is and that resonates.
Thanks, Dan. Yeah, and I think for me, listening to that, this whole thing about civil society and the role of charities and what this crisis has taught us, communities and how people have mobilised themselves, and the great work of charities in particular, because what's coming next, obviously, there's a big role for charities as much as there is for us now. And Jenny, in terms of your view around that question I posed, Dan, and I suppose also, how do we accentuate the positive online even more? Is there a way we can do that?
So I definitely agree in terms of the power of connectivity and that people's need to search that out. And I think that the way that we can harness that, as Dan was talking, is harnessing the power of communities. So I suppose I think a lot in my job about how you can harness the voice of patient communities, and I think social media and doing that online is a way in which you can do that kind of quite powerfully. I think a really good example of it is in the past couple of months, you've seen lots of the research-led charities getting together and campaigning. Clearly, they've had to make lots of cuts, and that will significantly impact their clinical research budgets. And I think that's been a powerful campaign. And I think I'd go back to that, Ovid, we're the creators of the Patient Partnership Index, which brings together pharma companies and charities to do good comms and good advocacy. And I think that, that's a really good example of where the positive can be brought out, where people's resources can be pooled and shared in that kind of societal reset that you're going to see over the next couple of years.
Thanks, Jenny. Ben, I'll come to you in a second. I'm just also reflecting on social care, actually, because we've done a lot of work around social care. It's a key area for us in Future Care Capital. And one of the things that's been clear to me is that there's been this view that has come out, in my opinion, during this crisis, that social care is predominantly, or maybe even very much, about elderly people in care homes, which of course it is, but there's so much more to social care, and there are so many other people who are accessing social care and in need of social care. So I just wonder how social media can play its part in that, because I've seen some really good examples of where colleagues and others are using Twitter and other social media to make those points. But even though social care has come to the fore in this, in many respects, I still don't think we've got to that point of full understanding that that's what social care is about. You got a view on
that? Yeah. Oh, sorry.
No, you go.
Sorry, I'll come to Jenny first, and then I'll come back to you then.
I do have a view, because I think that there's a fundamental tension between politically what can be done in social care and what can be understood and is happening. And I have to be very diplomatic about this, but I think that I think you saw in the first wave this complete rise in interest in social care and understanding, and I agree with you, it was largely on the elderly population, but I think actually I saw a national newspaper over the last week has started a campaign about children and vulnerable children in social care and visiting and the challenges around that. I think that fundamentally it comes down to a political judgment and question, as it always does, and I think that it's not a controversial point to say that if you're looking at it from a policy perspective, the problem with social care communications is that it can be quite reductive, and it can often, in a political lens, come down to assets and selling your home to pay for care. And as we all know, that is not just what the question and the challenge around social care reform and funding is about. I think it goes back to that grown-up conversation with the public, and whether that's about the pandemic or whether that's about social care, and that's what's needed.
Thanks, Jenny. Thank you, Ben.
I mean, well, I was just going to say the challenge, of course, with social care is just it's the level of complexity, the range of different private and public organisations providing services, which means that the public just has no idea about how it's organised until they need it, and when it becomes a sort of crisis purchase. And I mean, obviously, social media can play a hugely important role. And I think social media is much maligned. 78% of the public want it to be much more strongly regulated. And when I see some of the stuff Donald Trump comes out with, I'm inclined to agree with them. But so I think, as we've just heard from my colleagues on this panel, there are so many brilliant examples of connection and support that people build on it. It's true. But when we come back to social care, I don't think social media on its own is going to fix it. The system is so arcane and complex that unless it's only when finally perhaps the Department of Health takes it over entirely from local government, which I think for all sorts of reasons is actually a terrible idea, but it's because it just shows the underfund, unless they're willing to fund it properly, which is going to be the gazillion-dollar question, and we may eventually get there. And then finally, the only other challenge with it is partly because of some of the media coverage. When you ask who's handled the pandemic best and worst, the people who get blamed the most in Britain during this year have actually been care homes. Even though some of the things that went on in the first lockdown in care homes probably were not their fault.
Thanks, Ben. Yeah, I think that's a very good point. I'm going to stick with you actually on this, just as I unpick a little bit more the role of social media. On the negative side, we started to look at both positive and negative, but when we think about this pandemic perhaps as an infodemic, and we think about social media, as you suggested, as a place where misinformation is propagated, particularly the anti-vaxxer content that's been emerging recently, and obviously what we're seeing day to day today as well with Donald Trump, and the reaction of Twitter to that. What are your views on combating these harmful effects? You've mentioned regulation, but
I mean, actually, in fairness, yeah, I mean, there's a great quote that I've just noticed by Eric Schmidt, of course, who was on the board of Google, chairman of Google for a long time. And he said, we never intended social media to be a massive way of amplifying idiots and sort of loons. And it's like, well, get wise with the program, Eric. But no, I mean, there's plenty of evidence that it's having a major effect. So if you look at the people who believe that the entire thing is a plandemic, that it's made up, that it's a conspiracy, and they are out there, about 7 people in 100 say that the whole thing is a fraud. They turn out, of course, to be people who rely heavily on social media for their news. And partly because of that, demographically, they tend to be younger. I mean, we're part of it because we're running a major part of the government's testing program. And so people say, yes, you're working. I notice you also work for Bill Gates. So you're clearly somehow connected to 5G, Bill Gates, and you're definitely, that COVID testing is actually harvesting everybody's DNA, isn't it, for some great reset that you're going to do. And it's part of a compulsory vaccination program that's being done. I mean, people literally believe this stuff. I was talking to a government minister who said that she was speaking to her friends, and some of them actually believe this stuff, which I thought was pretty fascinating. So, no, I think you have to squash it. There's an interesting point about, I mean, we've done a lot of work on disinformation and fake news. You have to call it out. But the difficulty is the way the algorithms work is that sometimes the very act of calling it out attracts more attention to the conspiracy in the first place. And I know Dan is expert on this, but I often look at the people who are spouting bullshit to me on Twitter and decide whether to block them, whether to ignore them, or whether to respond. And you have to, there's a judgment call. My colleagues just want me to say nothing at all, but actually sometimes pointing out that this is just completely mad, I can't resist it, to be honest. I probably should, and we do need to be careful. So, but more positively, I'll give you Ofcom, who have been tracking how much fake news on the virus people think they've been exposed to, and the only positive I'd say, and it may be because of Facebook closing down QAnon and some of the things Twitter's doing, at least on labeling some tweets and blocking and removing some groups. Very crudely, Ofcom have reckoned that the proportion of people exposed to fake news on the virus has actually roughly halved over the course of the pandemic. And I think that so maybe finally we're waking up to doing something about it. But it is pretty endemic and pretty unpleasant.
Greg, can I just come in on that point?
You mentioned algorithm. Oh, sorry. Go on, Jenny.
No, just quickly, because I think that there's obviously the group who are anti-vax, but I think there's a much bigger group who and allow me the alliteration, but the cautious COVIDs. And I think that there's, particularly amongst the millennials, you've got a group who you actually have to dig down really, really hard before you find out that they're actually not confident about in terms of uptake of a COVID vaccine. And that's the group for us as communications professionals who are the ones that you are going to have to seek out. They are not going to be posting content on social media about their uncertainties, but when you ask them and you ask the right questions, you find out they have concerns around safety, etc., speed of vaccine coming to market, etc. And I think that that's the group, if I was the government, I would be worrying about, because they are the ones that ultimately in 6 months, a year's time, 18 months time, you're going to need to take the vaccine. And it's going to take that amount of time to convince them to take it.
Thanks, Jenny. Excellent points. And Dan, I'm going to come to you now, building on that discussion. And also, just to prompt a bit more thinking, this idea that, well, not the idea, the fact that social media is not representative of the UK population in general. Just talk us through, in the engagement you have with your audience and your beneficiaries, and from your experience in this area around digital marketing and engagement, what's going through your mind about how we combat these effects of the sort of negative side of social media?
You're right. I mean, I think a lot of it is how we break out of kind of and reach the people who aren't necessarily looking out for this sort of information, how we become that first point of information before they see something else. For us, we do a lot of work on live content, because we know algorithmically live content spreads faster than pre-recorded content, and we kind of hope that actually we can outrun the kind of fake news, as it were, and kind of see if we can get a bit of a head start across places. So we do a lot on kind of live broadcasting and taking people's questions and really trying to be open and transparent in being an available source of kind of people to ask anything anonymously or anything kind of publicly, and really kind of get answers. So we've been broadcasting weekly on Facebook Live with our nurses since lockdown started, the first lockdown. And then since then, we've now scaled back to doing twice a month, but it's something we've been doing for a couple of years now. And across kind of
sorry, are you using nurses, Dan? Did you say nurses? Nurses are the most trusted people in Britain. So you've got the right people there. Yeah, very good. Yeah, not charity chief execs, but nurses. Very good. Yeah.
Thanks, Ben.
We're very fortunate to have a helpline in house, all staffed by an amazing group of nurses who really know their stuff and are really brilliant with taking people's questions and making them feel really that there's no stupid question, that everything's kind of very much open for kind of talking about. And we've done whole sessions on how you can kind of deal with the isolation of kind of going through lockdown by yourself, and talking about what services we still have available, doing questions about people's secondary breast cancer treatments and side effects they're going through. And as you say, having those nurses there is just such a brilliant way of us putting ourselves forward there as a kind of point of trusted information, and hopefully in front of people's faces before they see the kind of misinformation that's floating around.
Thanks, Dan. And Ben, your point about the list of sort of most trusted people, top to bottom, there is a question that's come through which I'll pick up in the Q&A shortly around charities and other organisations and trust. Yeah. Just thinking about the noise that we've referred to a number of times. I mean, obviously, US election recently, and the economy and Brexit. In an ideal world, roll the clock forwards, Brexit's done, sorted. The economy is back on a level, and the US election has concluded, and Joe Biden is going about his office. Sounds great, doesn't it? So what's going to fill the void that's been this noise that we've had? Are we going to have something just fill the void again on social media? Or do you think there is a way of things calming down in some respect? Where does it all lead us around public health comms and social media generally? I'll go to Jenny first on that.
Oh, thank you. I mean, I think I can think of a lot of things that could fill that void. I think I could think of a coronavirus pandemic inquiry that will last a long time and cost a lot of money. I think that you will have I think a renewed focus. We talked about social care. Will clearly have for years and years later the after effects in terms of the other health conditions. I think that the obesity crisis, you saw the former chief medical officer talking about that over the weekend. I think that will become the next big public health communications challenge, which will certainly be at the back of the government's mind and other people's mind. And I think vaccines still, because I think the world has seen the effect of a pandemic, and I think vaccines again will come to the fore in terms of confidence and uptake. So yeah, obesity and vaccines will fill the void.
Thanks, Jenny. Dan, any comments on that one?
I think from our side, it's kind of, as I touched on earlier, I think the void will be kind of filled by what should have been talked about over the last 6 months, year, and actually picking up conversations that have been kind of muffled in the background. So for us, it's these huge kind of backlogs of people who haven't been receiving the treatment or haven't been getting the scans they need. So really trying to kind of make up for lost time. I know we're one of the organisations that that Jenny, you mentioned about earlier with the research funding, and we've been hugely affected. And for us, a big thing will be actually how we make up for that lost time. We've lost so much kind of our kind of the funding we've put into these labs and with these research scientists. And I think actually how we can really speed those things up, because people are waiting on us for like life extending treatment, life saving treatment, and it's really important that we don't kind of slow down on that. So I think the conversation will very much turn to, let's kind of get things, let's make up for lost time, let's pick things up, let's kind of get back to where we should be, and hopefully kind of push people into the right kind of space rather than letting it kind of fill with something kind of something trivial.
Although it's worth reminding ourselves, of course, that the vast majority of stuff that people tweet about or post on Facebook has nothing to do with anything worthy, or even the pandemic. Celebrities, football, what's on telly, Strictly, etc., etc. I mean, although Greta Thunberg did get more searches on Google search than Beyonce last year, so I was thinking that climate change would cut through. But no, there are so many challenges facing the country. Quite apart from even if the virus disappeared tomorrow, we would still have how we're going to fund our public services, our aging population, the NHS funding, social care funding, the house building crisis. We'd have plenty of things to sit and worry about. I'm afraid, and then something, and then politics. The world has a way of bringing up some news for us to worry about, unfortunately. But I do think, I absolutely take the point. I think Michelle at Cancer Research UK told me that their estimate informally was 30 to 100,000 people dying early because of a late diagnosis or misdiagnosis on cancer alone. So we will have plenty to keep us busy.
Thanks all. I'm mindful of time. We've got about 12 minutes left, and it's a great discussion. Thank you so much. And I'm just looking at a couple of questions that have come through, which I'm going to start to bring in now. So there's one from Amy here at Imperial College Health Partners, thinking ahead to some of the dilemmas we may face as a society, for example, immunity passports related to vaccines, etc. What's the panel's advice to government about how to bring the public with them as further policy is developed at pace and key decisions are made? So we've touched on this in some ways, haven't we, so far today? But Jenny, initial thoughts?
Well, I don't want to take Ben's polling thunder because I'm sure he's got lots of data on it, but we did do some polling recently on the carrot and stick approach in terms of, if you gave people a 20% reduction in their council tax, would it make it more likely that they would take a vaccine, et cetera, et cetera, et cetera, and all kinds of things. And by and large, it doesn't work. It doesn't make a meaningful difference in terms of people's behaviour. I think the only one from memory was about more freedom to travel. would be the only thing that made people change their mind. So I think that for the government, again, I know I sound like a broken record, but it goes back to having a grown-up conversation about what life means and what compromises that will involve and what collectively that means that we have to do to make the best possible job for the most number of people. I'm not sure short-term or medium-term policy tweaks are going to make a great deal of difference in the scheme of things.
Thanks, Jenny. Ben?
Well, I mean, it's a good question. I think the thing here is to understand where people are coming from, and so there are lots of tools, some of which Amy is involved with actually at Imperial Healthcare Partners, on deliberating with people and understanding. So we just don't need sort of knee-jerk reactions to some things from people, and we shouldn't always think about the knee-jerk reaction. But if we going on having that mature, trying to have that adult-to-adult conversation, even though it's very difficult to do that on social media or to do that in the media, is really, really important. And understanding, before we launch things, testing things out, understanding how they'll be received, even though we might rationally think this is what these are the facts. Making sure that you've done your research, however you do it, is really important in actually optimizing your communications, making sure that the messages you're using are the ones that actually cut through and have value. I mean, and Brexit is a brilliant story of one side just missing entirely the concerns of the other. So the Remain camp just talked all about facts and numbers and the economy, and meanwhile the other side are talking about emotion and taking back control, and won by a country mile. And the fact that Britain's economy will be short, even though the government itself admits the economy will be smaller, that didn't matter because it wasn't for a lot of people and a thing about the economy. It was about emotion and take back control. So in the same way, when you're doing your health messaging, understanding how your messages are received, which parts of the argument are most powerful, is really important. And you can only really get that from qualitative work or deliberative types of approaches, whether you do those online or in any other format.
Thanks, Ben. And Dan?
So I think completely echoing the points that Ben and Jenny have made there. I think it's so important to bring people along with you. I think if you're not listening, it's really, really difficult to get any of that trust and have any of that actual kind of feeling that you are being kind of involved in these decisions and processes. We kind of, going through the first part of lockdown, partnered up with over 20 other cancer charities to kind of create a coalition together called One Cancer Voice, with the idea being actually that we can do more together and be more trusted together and actually do more to listen and take our supporters with us and take people affected by cancer. So we kind of were able to do that, and as one unit together, we're able to actually have kind of work much closer directly with the NHS and do kind of create these partnerships that actually help us get trusted information and kind of changed information kind of through quickly, rather than needing to kind of hold things up or kind of be putting things out in competition with each other, essentially.
Great, thanks, Dan. That's a really useful perspective. And that was, as I said, it was Amy Garlington from Imperial College Health Partners who asked that question. Thanks, Amy. Now we've got another one here as well from Andrea Tofa. I hope I've pronounced your surname correctly, from the Resuscitation Council UK. And Andrea asks, there's a brilliant editorial in the BMJ about COVID-19 around politicisation, corruption, in inverted commas, and suppression of science. What do you think health charities and pharmaceuticals should be doing to ensure that they maintain public trust? And I suppose we'll all have a view on this. I might start, if you can indulge me for a second, by just jumping in myself and saying, certainly in terms of charities, Ben raised the point earlier around this sort of perceived level of trust from the public, of people in different organisations and positions in society. Certainly from the perspective of charities, and as someone who runs a health and care charity, I mentioned earlier that I think organisations like mine have a huge role with civil society in shining a light on some of the challenges that we faced through crises like this, and shining a light on where the opportunity is for charities to add value and make more impact working with communities and others. I think there's a real role for charities there. And part of that as well is about getting the message across, where you can, holding sort of fire to the feet of leaders and decision makers in your position as a charity leader, and in terms of what you're there to do. So I think there's certainly more that charities can do, and that idea that civil society, in my view, has become an area of our society where people have started to recognise maybe even more the impact that charities really do have and the importance of them, and leaders should keep that in mind. But Jenny, your views on that?
Yeah, I think I'd reflect on my experience working with the pharmaceutical sector. So yes, I think it's about telling the story of the science, but I don't think that's enough in and of itself. And I think while you were talking, I was thinking about the example of the husband and wife couple behind BioNTech, the company who's worked with Pfizer on one of the COVID vaccine candidates. And the fact that story of them being a married couple, working together, developing a vaccine, had so much more cut through, I felt, with the general public on the story of a vaccine than plenty of other stories that have been written about the mode of action and how it will be taken and what it will mean. And I don't think that's a bad thing, because I think that you need to tell the story of the science and the people behind the science. And I think that will go some way to helping to suppress the concerns and the worries and the anti-sentiment towards it.
Thanks, Jenny. Dan?
Yeah, so I mean, even just building directly on Jenny's point there, we've kind of decided to even have our researchers, while they're not in their labs currently, kind of answering people's questions and kind of being really open about actually what is happening with researchers while they can't be in the labs, kind of showing actually what can they be progressing on when they can't be with their equipment, how can their studies be continuing, because for a lot of people that's their life, that is what their daily hope is through those treatments, and seeing them kind of pause is so frustrating. So I think kind of humanizing it, showing actually the side of these kind of researchers who want to be back in the labs, they want to be working hard, they want to be finding these kind of new treatments, I think is really important. And again, I think just having that kind of transparency and that kind of openness in the work we're doing and the way we're having to change and the way we're looking to kind of keep being there for people, I think is really important in showing actually that while kind of it's a very kind of confusing time, that actually we're trying to be the least confusing possible in this and really be open with people and show everyone exactly what's going on.
Great, thank you, Dan. And Ben?
Well, first of all, I would try and cheer up everybody from the third sector or charity sector that, trust in charity chief execs isn't as high as it is in nurses, but charities are still much more trusted than many other of the players we're talking about here, particularly as there isn't a profit motive involved, which is more of more of an issue for my pharmaceutical client friends. But I think there is, where science is good is obviously, generally science is good. Let's be straight, but it's where there's absolute certainty. I think where there's the challenge facing us with a respiratory disease we don't fully understand, etc., is where it isn't clear, and it's how you communicate uncertainty. And I think we've all got to learn a bit more about that, because the public just don't like uncertainty, and they don't like that. That is part of the challenge here, that when you're asking people to actually take risks, and of course leaving your house is a risk, but people don't think of it in the same way, and so that I think is just really, really difficult. And I think this takes us back to where we started this conversation about the need for consistency, if at all possible, and that's sometimes difficult when there is a politicization of a conversation and people's views are polarizing, etc. But if one can achieve that, and if charities can achieve that, we will all get out of this much better.
I think part of that is about choosing the right advocates. Here we talked about nurses. You talked about the campaign over the last decade around mental health and having celebrity advocates who really push the conversation on. I think it's about choosing the right advocates for these types of public health questions.
I think that's very true. And actually, mental health is a brilliant example of how we've changed the conversation and, you know, taken the taboo away in a very dramatic way in Britain, in a very short time. So, hey, maybe on coronavirus, something could be achieved like that too.
Well, Ben, your final comment there, or that comment, took us directly to 5 o'clock. I'm just going to wrap up now. First of all, thanks, Amy and Andrea, for those questions. I'm going to just wrap up by asking each of you very, very briefly on your sort of key prediction for the, say, 6 months to a year ahead in terms of public health communications. I'm going to start with Dan.
I think kind of for me, I think the next 6 months to a year are going to continue to be really tricky. I think we're still going to be going through this whole frame of people being very uncertain, people being very unsure, everything about kind of rebuilding that confidence and rebuilding that connection with people, I think, while kind of messaging is changing, because I'm sure this is probably not the first time we'll go in and out of lockdown and tears will come out and all these different things. And I think making sure that actually we are understanding of the fact that people are kind of going through these constant changes and are kind of being told these conflicting and seemingly conflicting messages all the time. It's going to be really key. We know kind of Christmas is going to be a particularly weird one and a particularly tough time for a lot of people, whether you're kind of in social care or whether you're kind of in hospital or other kind of treatments and things. It's going to be a really, really difficult time. So I think just being really kind of consistent and understanding and compassionate, I think is really important.
Thank you, Dan. Thank you very much. And Jenny?
Yeah, I'd end on a positive note, hopefully, and hopefully I think we'll see the power of communities and connectivity kind of driving a force for good. I think you've seen that in some of the recent campaigns over the past couple of months. So that's what I hope will happen.
Thank you, Jenny. And Ben?
Just empathy and consistency. If we can manage empathy and consistency, even if it means being consistent about the uncertainty, that might help.
Great. Thank you all. And thank you for everything you've brought to the conversation today. Thanks to all of you who tuned in to listen to this and the questions that came through. And for your interest in the research that we've been doing at Future Care Capital with Ben and his team. If you do want to get in touch, you can see it on the slide there with the email and the way you can reach us. But I'm going to close it there. Thank you all and enjoy your evening.